Breaking the silence, the hidden cost of trauma in Black communities. I was taught to swallow my pain. These 7 words from Leialni Buckley, a remarkable advocate, survivor, and beacon of hope in the mental health community, stopped me in my tracks during our recent interview. Her voice carried the weight of generations, steady but laden with years of carrying burdens that should never have been hers alone to bear. What makes Leialni extraordinary isn't just her courage in sharing her story, but how she's transformed her pain into purpose, creating pathways to healing for countless others who have been silenced for too long. For generations, Black women like Leialni have been handed an impossible script: be strong, don't complain, keep family business private, push through, survive. But at what cost? What happens when we swallow our pain for so long that it becomes part of our cellular memory, our DNA, our legacy? Today, I want to talk about what happens in the spaces between survival and healing, about the price we pay individually and collectively when trauma goes underground, about why, for Black communities especially, breaking silence might be the most revolutionary act of self preservation we have. I'm not here to offer easy answers or quick fixes. I'm here because of women like Leialni Buckley, whose courage in speaking her truth illuminates a path forward for all of us. The data tells us something profound is happening. Black Americans are 20% more likely to experience serious mental health problems than the general population. Yet we're also significantly less likely to seek help. This isn't a coincidence or a character flaw. It's the predictable outcome of systems designed without us in mind, of historical traumas left unaddressed, of cultural mandates that prioritize strength over vulnerability. When Lealni shared her journey of finally seeking therapy after decades of silence, she described the weight of not just her own hesitation, but generations of cultural messaging. In my grandmother's day, you prayed about your problems. You didn't tell strangers about them. This isn't just about personal choice. It's about survival mechanisms that once protected us, but now hold us captive. Think about it. When your ancestors lived in a world where showing vulnerability could literally get them killed, stoicism wasn't just a personality trait, it was a shield. When medical institutions have historically used Black bodies for experimentation without consent, mistrust isn't paranoia, it's a rational response to historical trauma. But here's the brutal irony: the very silence that once protected us is now killing us slowly, invisibly, but just as surely. Let me share something that broke my heart, but didn't surprise me. In a recent study of 43 Black perinatal women in the southeastern United States, researchers uncovered a pattern that speaks volumes about the cost of keeping trauma hidden. These women, already navigating the vulnerability of pregnancy and new motherhood, reported deep medical mistrust based on previous encounters where their pain was dismissed, their concerns minimized, their humanity questioned. One participant said, I learned quickly not to mention feeling sad or anxious because then I became a stereotype: the angry Black woman or the welfare queen who couldn't handle motherhood. The consequences? Many stopped seeking care altogether. They suffered in silence rather than risk further humiliation or harm. They chose isolation over the possibility of being misunderstood or mistreated. This isn't just about hurt feelings, this is about life and death. Black women are 3 to 4 times more likely to die from pregnancy related causes than white women. Black infants die at twice the rate of white infants. And a significant factor in these disparities is the quality of care received or not received because of these broken trust relationships. But there's another layer to this story that doesn't get enough attention. Research highlighted in my conversation with Leialni shows that US born Black adults experience significantly higher rates of psychological distress than Black immigrants. This suggests something profound about the cumulative impact of living under systemic racism from birth, a kind of chronic stress that literally gets under the skin. As one researcher put it, it's not just about individual racist encounters. It's about navigating systems that weren't built for you day after day, year after year, that takes a toll. The study revealed that US born participants were at higher risk for moderate to severe psychological distress compared with immigrants. This was linked both to exposure to racism throughout life as well as internalized stigma about seeking help, a dynamic reflected in Leialni's journey from childhood silencing through adult self blame. What's particularly striking is how this research emphasized the need to disaggregate data within the Black category so interventions could be tailored based on nativity and background. Not one size fits all solutions. It called for culturally specific outreach strategies that recognize the unique experiences of different groups within the Black community. The impact has been significant. Major public health agencies began revising survey methods after publication. Community groups used findings as leverage for targeted funding requests. More accurate data now drives better advocacy, and more survivors see themselves reflected in policy conversations. And here's where it gets even more complicated. Even when Black Americans do seek help, they often face what I call the triple barrier: lack of access, lack of cultural competence, and lack of trust. Let me break this down. Lack of access. In many predominantly Black communities, there are literal mental health provider deserts, entire counties without a single licensed mental health professional. If you can't afford to travel, if you don't have reliable transportation, if you can't take time off work without losing pay, help might as well be on another planet. An investigative report highlighted how systemic racism leads not just to individual pain, but also to these structural inequities. Black people are disproportionately uninsured. Even with insurance, they face clinicians who may dismiss symptoms or misdiagnose them due to bias. Fear of discrimination stops many from even trying. The same shame driven silence described by Leialni. Lack of cultural competence. Even when providers are physically accessible, they may lack the training to understand how race, culture, and trauma intersect. As Leialni described from her own experience, I spent 3 sessions explaining racism to my first therapist before I realized I was paying to educate her rather than heal myself. Lack of trust. Given the historical abuses by medical institutions against Black communities, from the Tuskegee experiments to forced sterilizations to present day disparities in pain management, many Black Americans approach healthcare with justified caution. This isn't paranoia, this is pattern recognition. But here's where I want to pivot from problem to possibility, because despite these formidable barriers, healing is happening. Communities are innovating. People like Leialni Buckley are breaking generational patterns of silence. In those same communities with provider deserts, advocacy groups are pushing for increased funding targeting underserved areas. New telehealth initiatives aim at bridging gaps where no local professionals exist. In pilot regions where these changes were implemented, service utilization rates rose sharply among previously underserved populations. Churches are creating wellness ministries that bridge traditional faith practices with contemporary mental health support. Grassroots organizations are training community members in basic mental health first aid. And in healthcare settings that have implemented recommendations from studies like the one with those 43 perinatal women, changes like hiring diverse staff, implementing anti bias training, using patient centered language, utilization rates have risen dramatically. As one participant in that study said after experiencing a new model of care, For the first time, I didn't have to choose between being Black and being honest about my pain. That sentence contains multitudes. What if we created a world where no one had to make that choice? Where bringing your full, authentic self to healing spaces wasn't an act of courage, but simply the expected standard of care. This isn't just about individual healing, though that matters profoundly. This is about collective liberation. Because when we break the silence around trauma, we don't just free ourselves, we create a permission for others to do the same. We interrupt patterns that have been passed down like unwanted heirlooms. Leialni Buckley described this beautifully when she said, "The day I finally spoke about my pain was the day my daughter learned she doesn't have to carry mine. That alone made it worth it." This is how generational healing works, not in grand sweeping gestures, but in these small, brave moments of choosing a different path. I want to be clear about something. I'm not suggesting that the responsibility for fixing broken systems should fall on those most harmed by them. The primary burden for creating equitable, accessible, culturally responsive mental health care belongs to institutions and policymakers. But I also know this: our healing cannot wait for perfect systems. Sometimes breaking silence is itself an act of revolution. As the poet Audre Lorde reminded us, your silence will not protect you. So I challenge you today, right now, to examine your role in either maintaining or breaking these cycles of silence. If you're a Black person carrying trauma in silence, I want you to know that seeking help isn't weakness. It's wisdom. It's resistance against systems that benefit from your suffering. It's revolutionary self preservation. If you're a healthcare provider, examine your practices. Are you creating space for the full humanity of your Black clients? Are you doing the work to understand how trauma, race, and culture intersect? Are you listening, really listening, when Black patients speak about their experiences? If you're an employer or leader, are you creating workplace cultures where mental health is prioritized for everyone? Are your benefits accessible and comprehensive? Do they include culturally responsive options? And if you're simply someone who cares about creating a more just and healing centered world, start by believing Black people when they share their experiences. Advocate for policy changes that address provider deserts and training gaps. Support organizations doing this work on the ground. The time for silence is over. The cost has been too high, the loss too great. Each story unspoken is a possibility unrealized, a future diminished, a wound that continues to bleed across generations. Today, I'm asking you to join me in creating a world where breaking silence is celebrated rather than punished, where healing is accessible to all, where no one has to choose between their cultural identity and their mental health. This isn't just about talking, it's about transforming our systems, our communities, and ourselves. It's about recognizing that true strength isn't found in silence, but in the courage to speak, to listen, and to change. The healing of our communities depends on it. The future of our children demands it. And the revolution, the real revolution, begins with these three words: I am here.